For the next thing we are considering or discussing is what is known as a ruptured tubo-ovarian abscess. So you have a tubo-ovarian abscess. When you say tubo-ovarian, that means there's an abscess in the fallopian tube and there's an abscess is tracking down the ovaries. Do you understand? So abscess is collection of pus. So when it is ruptured, that means what? The pus breaks open, spills into the abdomen, okay? Spills into the pelvis. Do you understand? A whole lot of complications could actually result. So it's a surgical emergency and it can rapidly progress towards inflamed peritoneum, that's peritonitis. The bacteria could get into your bloodstream, causing a sepsis, and sometimes could actually even result to death if not treated immediately. So what is tubo-ovarian abscess? It's collection of pus, and the pus is collected in the fallopian tubes and the ovaries. So usually it is coming after a pelvic inflammatory disease. Okay, so rupture is when the abscess breaks now, the material spill into the peritoneal cavity, okay, cause a lot of infections. So clinical features of the rupture is there's a lot of pain, signs of peritonitis, there's fever, chills and tachycardia, there's hypotension and septic shock, there's nausea, vomiting and generalized abdominal tenderness. So what's the emergency management? Hospitalization is mandatory. Now because you have something spilled out there in the abdomen, you want to actually give a broad spectrum antibiotics because there's a risk for infections. Then you do laparotomy and laparoscopy just to drain out the pus and wash the peritoneal cavity. Okay, they can also do surgeries just to remove the fallopian tube and also the ovaries. That's what is known as a salpingo oophorectomy. The supportive care is like intravenous fluid, vasopressors if there's shock, pain management, and keep monitoring for sepsis. So what's the complication? Sepsis and septic shock can lead to death. Now because the fallopian tubes are greatly affected, the individual can suffer from infertility later on. There's chronic pelvic pain. It could lead to a risk of ectopic pregnancy. They could have adhesions in the pelvis and also the abdomen. Alright, so that's what we have for a ruptured tubo-ovarian abscess.